kid is 13, you start becoming alarmed about depression if the child is not showing a lot of pleasure in things. If the parent even tells you that, he was very active in this sport, or he was very much like to play a certain game, and suddenly the kid lost interest in a lot of his usual pleasurable activities. You also look to see if they complain of being tired, having little energy. You also, their appetite, if they overeat or if they really have a poor appetite. Those are signs for children of depression. So kids, and they start to talk about, especially when some of the kids will say, I think the world would be better off, or mom and dad, you'd all be better off if I wasn't here. We get a lot of that with kids who are depressed.
That isn't an evaluation. That's an emergency.
Yes.
That kid should be referred immediately to a place that has a psychiatrist to intervene and say an emergency room or something close to that, because there are kids today, unfortunately, that do commit suicide. Is that correct?
Yes, very much so. The suicide rate among teenagers obviously has been rising for many years. And certainly when a kid starts talking about that they want to hurt themselves or kill themselves, it's not just something that you make an appointment 2 or 3 weeks off when you can get one. If you have to, you go to the emergency room where they will have a psychiatric consult. One of the things that's even particularly threatening is if a child starts to, if you ask the child, well, what would you do? How would you do it? And if they actually give you a plan, perhaps they've even said, you have all those pills in the cabinet. If I wanted to, I could take them all. Whenever they have an actual idea or plan, that's another very serious sign.